Hi, everybody. Happy Monday. Hope everybody had a good weekend. The weather was decent, at least in Cincinnati, so that's great. So as usual, I'm going to run through some data and then take your questions. So since Friday, global cases have increased to 755,000. That's up from 580,000 on Friday. Global deaths have increased from 27,000 to 36,000 since Friday. The U.S. cases have climbed from 94,000 to 148,000 today, and the deaths are now at over 2,500. I will make a point to say that really China has not increased. Italy has increased up to 101,000 from 86. Spain has increased from 64 to 85,000, so even a more rapid rate of growth. And the death in Italy has increased above 11,600. They actually had 812 deaths in one day. So it's terrible. Italy, maybe the rate of increase is slowing a little bit, but certainly they're still increasing. US, so 148,000 up from 94,000 on Friday. What we know in New York, that still remains to be the epicenter, although Detroit, Louisiana, and Chicago, as well as California, continues to be a hotbed, and we're seeing a big growth in Florida as well. But again, New York is really at the epicenter. So of the 148,000 cases, New York is at 63,000 cases, and 36,000 of them, so continues to be more than half in New York City. The New York deaths of our 2,400 are above 1,000, so almost half of the deaths, and 790 of them are in New York City proper. So again, the epicenter, the hub, it's rapidly growing in New York. What can I tell you about Ohio? So we are at 1,933 cases in the state of Ohio. That's up from 1,137, so up about 780 or 800 cases over the course of the weekend. Our deaths went from 19 on Friday to 39 today. We have 475 patients in the hospital. That's more than double what we had on Friday. Our ICU patients are 163. In Hamilton County, we are 101 of those 1,933 cases. We have 15 hospitalized patients in Hamilton County with COVID. So I would tell you that as I was watching the trend over the weekend, that I was a little bit optimistic, because although clearly going from 94,000 to 148,000 is a huge increase, it appears that maybe the rate of increase is slightly slowing. I would tell you, I actually think in in Ohio, we've been relatively flat with the percentage increase we're seeing. And I have to believe that that's really related to the stay at home and what Governor DeWine has really continued to insist. So again, I think the take home, if you've been listening to any of the news, the president or Dr. Fauci, I think it's very clear that what we want to do is stay at home long enough that we really don't have the peak and overwhelm the health system, which is still such a potential to have what Italy is. So the good news, I think, and I'm really happy to see this, that President Trump really has extended kind of the social distancing and the guidelines through April 30th. In my opinion, that's a much more reasonable timeline than certainly the Easter Sunday was. Now, again, will that be long enough? I think it's not clear, but 4 weeks gives me great hope that maybe that will be enough if we really all continue to participate in social distancing. Some other big news. So the Navy ship Comfort docked in New York Harbor. That's really fitted for taking care of non-COVID patients, trying to offload some of the hospitals, which are so overrun right now, and I think that's a great thing. You may have heard Macy's is furloughing most of their 130,000 employees now, which is a huge, big layoff and obviously impacts Cincinnati greatly. You may have seen yesterday, Sunday, the FDA actually approved hydroxychloroquine for emergency use. And I want to make sure that everybody understands that again, because as I've said previously, I don't believe at this moment, when we don't have adequate supplies of the medication, that it's appropriate for healthy people to stockpile that when they're not sick. Again, now, use when someone is progressing and sick, and clearly the clinical trials are being done in New York, so we really understand this. I don't think it's, again, unreasonable to use this off-label for COVID now because we simply don't have anything else. A couple other good things to note is that over the weekend there was a rapid test that was also approved, and I don't know the timeline of scaling that out. This is almost like a point of care test that you can get really rapid results in an office, so that's good news. They're moving forward with serum serology testing. I don't know when that's going to be available, but in my opinion that has huge potential value, because if we can test people, see that they have positive antibodies, that really is, we think, at least right now, we don't know how long those antibodies will last, but at least in this acute epidemic, really good news. And those people who have antibodies should be on the front lines. The people that don't have antibodies, we know haven't been infected, and those patients should, again, practice social distancing. Now, again, will that be available in Cincinnati for healthcare workers here in the next 4 weeks? My guess is probably not, but I would love to think so. Maybe the commercial labs will be able to roll it out fast enough. I'm not really sure. There have been reports now, actually a report out of Kentucky about testing and getting false negative results. So in one article that I read, it was up to 40% false negatives. So the discussion in the article was really about the fact if you have flu-like symptoms, cold-like symptoms, a fever, a cough, even if your test, if you're lucky enough to get a test, is negative, you should presume that you still have it. And again, be very careful with social distancing in your own family unit and really trying to do the best that you can. The false negative rate, it can be, again, many reasons. One of them is inadequate swabbing of the nasal passage. As you may remember, my husband talked about a couple days ago, doing an appropriate nasopharyngeal swab is actually pretty uncomfortable and requires really the swab going way far back. Patients don't like it at all. And so again, I can imagine, not that I have been doing the swabs in the drive-through lines myself personally, but if you have a patient in an automobile as a physician or a clinician or a healthcare worker trying to do a nasopharyngeal swab, I predict that that's pretty hard. So an inadequate sample may be one of the issues. And then another issue is just, again, either inadequate reagent, too much reagent, again, when they're running the test. But we'll have to see how that goes. So, take questions. My son lives in Chicago and his roommate have been social distancing for more than 2 weeks, working from home, only going to groceries for essentials, mostly getting delivery. He wants to come home to be with us. Your thoughts? Well, truth be told, that's exactly my situation as well. My son is in Chicago working from home and living with roommates and trying to do what he can to social distance. Again, depending on the hotbed of your particular area at that time, and Chicago certainly has increasing numbers right now, it's certainly possible still that these adults have been exposed and we don't know it. And so bringing that back into our community and into your family unit certainly puts you at higher risk. Now, with that said, is it worth taking that risk to have that individual come home for a couple weeks if that's what you choose to do? I think that's an individual decision. I certainly have been talking about it with my son. Again, my husband and I are both physicians. I think we are at higher risk than he is of being exposed. And so it's not just him bringing the infection into my home, it's me also potentially infecting him, which plays into the discussion as well. So it's gray is the bottom line. I don't think I really answered your question. And I think it's not an absolute no. I would say it would be an absolute no if there were 70-year-old individuals living in the same household, because those are the absolute highest risk individuals. So again, I think it depends on the situation. Are people with autoimmune conditions the same as immunocompromised? So Having an autoimmune condition definitely is associated with being slightly immunocompromised, and depending on the medications that you're on to treat your autoimmune disease. So it can be Plaquenil, which is hydroxychloroquine, which is the same thing we're talking about using to treat COVID, but it also can be steroids and other immune modulators and immunosuppressive drugs. If you're on any of those medications, you certainly are at higher risk. And again, you're the type of person I would try to put as much in a bubble and isolate for as long as possible through this. Now, again, if we're all now looking at April 30th, and again, I hate to be too optimistic that that will be the accurate date, but at least for me, that gives me a goal to get to. So really 4+ weeks from now, that seems like something, if we all get our head around it, we can do. And again, for anyone that's even mildly immunocompromised, I would really do 100% everything you can to keep yourselves isolated and self-quarantined. I have had many questions from friends this weekend regarding COVID and children, infants. Many articles are circulating on social media. Are you aware of any updates, data as it relates to children and COVID? So I can tell you what I know. I believe there was the first infant death reported in the United States related to COVID, which is a concern. I think when you look at the spread of numbers, even in the state of Ohio, there was one infant that's been infected, and it's all the way up to 95 or 98, but very elderly. My understanding is that we don't think it's perfect that infants cannot be exposed and young children exposed and contract the virus. What we don't really know yet is if they're contracting it and actually having a completely asymptomatic infection. But when we look at the numbers of patients that are hospitalized and who go on to have very severe critical illness, ARDS, and die related to this, require ventilators, it's really not the kids. In fact, I spoke with one of my colleagues who's faculty at Cincinnati Children's over the weekend, and he told me that they have no active COVID cases here in Cincinnati at Children's, although they have several faculty members and healthcare workers from Children's that do have COVID. So a long answer to say I don't have perfect data. I believe that children are somewhat protected compared to the rest of us. That wouldn't mean that as a healthcare worker, when I went home, if I had young children, that I would be frivolous and careless. Again, I think for healthcare workers going home with young kids, it's really taking your clothes off and washing them. And again, as I've said in my office, we're all wearing clothes now that we can take home and wash, not dry cleaning stuff, and taking a shower when you get home. And I think we'll have more data as it comes. Does chlorinated or brominated water kill the virus like a pool or a hot tub? That's a really great question, and I would assume that it does, but I do not know that. I have not been asked that question before, and I have not seen anything about that. I think that's an interesting thought, right? If you have a pool, and as it's getting warmer, if you open your pool, does swimming in your pool decontaminate you? And I don't know the answer to that. Or if you had people over swimming in your pool, does that kill any virus that they're shedding? And I don't really know the answer, but that's a really good question, and I will see if I can find out. Saw an article online about people socializing outside, just sitting 6 feet apart on driveways. Is that safe? So here's what I would tell you. Nothing is 100% safe. I would tell you that I am doing that a little bit right now. Again, social isolation, how much can you do on Zoom and these chat rooms with friends that feels really artificial. So yes, the guidelines are really maintaining a 6 feet distance because, that really is the main vehicle, the way that with cough and aerosolization of the virus, the way that it's spread. But again, I think, even if you have friends over and you're sitting 6 feet apart, you probably have an interaction that's closer than that. And because, again, we don't know how many people are shedding virus asymptomatically, it's not perfect. But I will tell you, I'm doing it, and I think that it's reasonable right now, again, to help us get through this phase of social distancing without losing our mind. As a healthcare provider, today the doctor is treating me as if I have the virus but did not test me. What's the best thing for my husband to do? So if you have flu-like symptoms and a fever, and I would presume really that you are infected, again, I hope it's very mild for you, but really what I would do is I would tell you you should really isolate from your husband, because we definitely know in the US lots of family contact is the spread. So one person in a family and then others getting sick, and there's definitely been lots of cases of that. In fact, I just read a situation in California where they had choir practice for several hours, and a whole group, I think it's over 40 people, were infected from one individual, and they've had 3 people die already from a 3-hour choir practice where whoever the person was that was sick was obviously shedding virus and infected a lot of people. So again, if you have a separate bedroom and you can sleep in a separate bedroom, if you can really be careful about, sitting at the table and wiping counters and, keeping that 6 feet distance, if you can do that, I would encourage you to do that. Especially, I would be fanatic if the person that you're living with has any reason, is elderly, or has any reason to be immune compromised at all, any chronic medical conditions. Is it primarily people's immune systems that account for the varying degree of how this illness presents? So we don't understand it yet, but it is absolutely fascinating that there's no question that there are a subgroup of people, right? So we think with this outbreak right now, again, we don't have 100% complete testing, but we think about 20% of people who are affected require hospitalization. That's the numbers that we see now with our current data. Somewhere between 9 and 11% require ICU stay, and the mortality rate is somewhere in the 1 to 2, 1.4% mortality rate, at least right now with the data as much as we have it, realizing that we aren't testing everyone yet. Now, what we do know is that the people, and there's a lot of markers, so I've been reading from emergency room physicians, there are lots of markers, inflammatory markers, that very clearly predict a poor and negative outcome in patients. And so it's not just low oxygen levels when the patient's in the emergency room. It's not only seeing infiltrates, on chest x-ray or on chest CT when they come to the emergency room, but these inflammatory markers, when they're revved up, and a low white blood cell count, I will tell you, seems to be critical markers of the fact that in this particular patient, there's a huge inflammatory response, which is what's leading to the very aggressive, progressive lung issue called ARDS, which requires prolonged ventilation in the ICU. And what makes one person have that inflammatory response and another doesn't, we have no idea yet, but I believe, the great thing about this is I know in our country right now, I've talked to some of my colleagues all across the US, that their IRBs, the research body that approves studies, have all entirely been focused on doing COVID research right now. So I believe we will develop huge, great basic science data, which will lead us to a much better understanding of the pathophysiology of the infection and how we can identify patients who are at higher risk of having complications, and then obviously treatment strategy. And again, we need to understand when patients are infected and recover and have antibodies, how long those antibodies last, and whether or not that confers lifetime protection to this virus, or whether or not, and we need to develop, obviously, a vaccine. So there's lots of good stuff coming, and I didn't really answer your question except to say that clearly some people have this very serious inflammatory response that leads to the lung condition, and others don't. I have seen reports now that potentially 50% of people who are infected have asymptomatic infections. That seems high to me, but again, there's lots of data being spewed out there, and until we really have robust testing, I think it's impossible for us to really know what that percentage is, but it's coming. Should we be wearing masks to go to the grocery store if we have a homemade one? Okay, so what the masks are doing is preventing you from shedding virus to someone else. It's not preventing you from being exposed to the virus. And so again, certainly if you have any reason to be self-quarantined or think that you've been exposed, I would encourage you to wear a mask when you're going to the grocery store. But the biggest thing about the grocery store, again, is after you've been there and you've touched everything and you've brought your groceries into your house, again, it's really hand washing. I talked on a previous Facebook Live about the videos that I've seen in circumstances where you're trying to 100% protect and decontaminate everything, and it's a very long, involved process. So the analogy is, if you have glitter all over your food, how can you get rid of the glitter on your food and your cardboard boxes and not get it on you and get all of those products completely cleaned? It seems to me, I believe that that's probably overkill. I wouldn't say it's overkill if patients are elderly, have chronic medical conditions where we really have to be ultra extreme cautious about exposure. But again, a long answer to say a mask I don't believe is all that helpful unless you have any reason to think that you are infected. The reason that I am wearing a mask in my office when I'm seeing urgent patients and my staff is wearing masks is because of the possibility that we have been exposed and could be asymptomatically shedding virus. So it's to protect our patients. Dr. Larkin, you know me very well. You know I don't take things real serious. In your opinion, do you think I should be working with my asthma being the way it is? Just wondering. So again, I'm sorry to say that I'm not sure if you're a healthcare worker or not. Again, if there was a way for you not to work because you have serious asthma, that would be an ideal thing if you have the ability to self-quarantine. But again, everybody's situation is a little bit different. Again, if you were able to work from home or self-quarantine for the next 4 weeks, I would encourage you to do that. If someone has an asymptomatic case of COVID, how long are they shedding viral particles and infectious? So this is really hard to know. From the patients that we do know that have mild infection and resolve, we know that you shed virus several days before you have any symptoms at all. That's the problem, right? So we're all walking around feeling fine, and if we have it, we're shedding virus. So that's a problem. We then know, again, it really is, we think 14, 18, 20 days from first symptoms that you still shed viral particles. What we don't know yet, and again, the paper that I saw with the most patients was out of China, is even if you can detect those viral particles, that doesn't necessarily mean they're infectious particles, right? So it's hard to know exactly right now. We don't have proof that if you are 18 days post a mild illness and you come in contact with Jane Smith, that we can confirm that that was the source of Jane Smith's infection. To be cautious, though, I would tell you if you have a colleague, and I would certainly say that for me in my practice, for example, if one of my staff members or other providers had a documented infection, I would absolutely say that that person had to be out of my office for 3 weeks for sure, because of concerns that viral shedding can go on that long. And again, hopefully a patient will be able to detect antibodies soon with the antibody test as well. All right. And I think that's it for the day, everyone. I will just make one note to let you know, over last week, we've gotten several calls for patients who are not currently our patients who have been ill and who have needed to be seen. One patient in particular really was dehydrated and needed IV fluids and was very terrified about going to the office. So again, just want to let you know we are available to do what we can to help in the practice. And certainly, although again, we're doing everything we can to make sure that our practice is not a vehicle for transmitting infection to other people. We're staggering our patients, only one person in the office at a time. We have one dedicated room for anyone that has flu-like symptoms. again, we really do want to try to help you. So if there is a circumstance where you are not currently a patient in the practice, we'd be happy to talk to you and see if we can help accommodate you with a visit, or if you need IV fluids or whatever the situation is. So please call us. Have a nice day, and I'll be back same time tomorrow.